We do have two guests in our attendees. We have a Mr. Robert Hess and a Victoria Palazzo. They are members of the public who did ask to speak during the meeting. So you should see their names under attendees also. Mr. Seaman will, during the meeting, when we get to the public comment section, he will allow them to be able to speak during that time. So you will be able to see them listed on the attendees.
Okay, and we are live.
Okay, good evening, everyone. Tonight we're going to go through our work session, and then once we finish up with that, we'll move to our voting session. So first we'll review the agenda and answer any questions pertaining to the line items leading up to this, and then we will break to go to the start of the voting meeting, and once we wrap that up, we will break briefly for an executive session for one topic there. Okay. So scrolling down, if Rose, if you don't mind just moving along down through the introductory portions of the meeting, we have our approval of minutes, our treasurer's report, the approval of bills, counting of taxes, student recognition. We will move to next month. We did have some conflicts with student schedules this month, but we will move along and acknowledge those students at the next meeting as well. We'll have our recognition of public. We have our enrollment report. And then moving along to the line items, starting with number 12. Bernice did ask that we add these two line items to the agenda regarding the health and safety plan and potential exemptions for the covering exemptions of covering requirements, as well as athletics and gym class. Bernice, would you like,
Matt, if you don't mind, I just wanted to hop in because I didn't speak to anyone on the board. I just wanted to let them know, because of the Sunshine Act, I just wanted it in there so we didn't have to vote to have it on there, because last month we did say we would discuss exemptions. And also I had some miscommunication. The board did, on an executive phone call, agree to no mask during gym class or any sports activity indoors. We agreed on that. Some gym classes are doing masks, some aren't. And so my thought was, some parents called the district office and said, why is my kid wearing a mask? They said, well, it was never voted on by the board. So this, at least just gives us the room for everyone to be on the same page and clarify that that is what the board did discuss. And we agreed that there would be no mask, and this mandate from the Department of Health states no mask in gym class. And so I just wanted that cleared up because I think there's a lot of misinformation out there.
Sure. Now, and Bernice, I know we did discuss when we put out the original health and safety plan with initially was mask optional, and then we did the tiered mitigation plan. And when the masks were optional, that was part of it, that the students in athletics obviously would not be required to wear the mask, but and phys ed was part of that. However, once the mandate was effective, they did outline guidelines for us to follow with masking in phys ed classes. So basically it's for—
And it does state here anaerobic and
aerobic.
Right. So, and this is where some people are picking, well, it's your heart rate has to be over so much to be an anaerobic or aerobic. And to me, that's ridiculous because we don't know the health condition of any kid or what limit it is. So I just wanted it, no mask during gym class. And listen, if you're sitting getting a health exam, I'm fully aware that's not gym class, that's health. But I wanted to hear from the board, since this is a work session, that is what we agreed on, and it should be voted on because there's a lot of miscommunication or misinformation throughout the district.
Well, again, and I would just reiterate that, you know, we're following the order as it's stated. So, and I know there, we spoke administratively this week about physical education classes and trying to be as consistent as possible with what we're designating as these types of activities that would warrant a mask not to be worn. And those when students are.
So could you then clarify what says a mask needs to be worn and what doesn't? Because that's what I think.
High intensity aerobic or anaerobic activities, including.
So what would be anaerobic activity?
Anaerobic activity? You'd have to ask a gym teacher, quite honestly.
Well, and if you look up anaerobic activity, it's a slight minimal increase of a heart rate. So that could be anything. That could be running from A to B. But yet that's not happening.
But also that the students have to be able to maintain, as it reads, the physical distance of 6 feet from all other individuals. So that can't always happen in a gym.
And
class.
I understand that, but for how long of a period of time? Because when we're quarantining people, it's for 15 minutes.
Which is what we're trying to avoid, is having to try not to have students quarantine.
But my point is, if the board could agree to no mask in gym class, listen, we're going to work to be the best of our ability. That's what we agreed on. And I would like to see that be brought forth because that is what we agreed on.
Yes.
Well,
Again,
I just have a question, Matt. So we agreed on it, whatever, back in August, let's say. The mandate came out from the governor and we voted to go with that. So the mandate that we're following, that was approved by the board, in that mandate, does it say what we have in 12 and 13, basically? I guess in 12 is what we're talking about right now. Is the governor's agenda, a governor's mandate say that in gym classes they have to wear masks? Just so I'm, so we're all clear on that. That's what because I know I'm hearing Bernice and I'm reading this and I'm thinking, well, yeah, we did vote on it, but then it got changed and it basically got taken out of our hands to a certain point. So that's where I'm at. Like, I want to know.
Joe, I just wanted to let you know, this is straight from the Department of Health itself.
Correct.
This is from the mandate then that.
Yes. Yeah. This is
all right. That's what you mean. All right. I just want to make sure. All right.
Yeah. So Joe, this language, Bernice is correct. This is from the mandate from Department of Health, but this did come out after our plan was approved, essentially.
Okay.
So,
okay. All right.
So it changed at that point.
Okay, so does everybody understand that one?
I don't. I still don't understand why we're passing the individual provisions of the mandate. I mean,
well, Ethan,
if we're following the mandate, then we're following these two exceptions as well. So if there's an issue with communicating it to families and communicating it to gym teachers, then that's one thing. But I really don't see the purpose in passing these two exceptions when we've already passed them in effect by following the mandate.
Well, then we have a problem with it being followed. That's the thing. Because there are kids in gym class who have never taken off their mask for any activity. So are we following it? I would have to say no.
Well, that might be up to the individual kid not to take the mask off. That doesn't necessarily mean.
Now,
Yeah.
it hasn't been, but I understand your point, Matt. Yeah, if that's the option, that's their option. But there has been some families that have reached out saying, and questioning, why isn't my child not taking off their mask during gym class? I'm one of those parents. So.
And again, I know
across the board.
And I know from a couple of those conversations, the gym teacher expressed what they believed was, if it was or was not an anaerobic or an aerobic activity, and what the activity was and the reason for it. So I
understand. I'm just asking, like, we've been a month into school. And so you really are telling me that not one gym class at lower levels have taken off their mask? So
no, because many of the gym classes have been outside whenever they were.
I'm saying the lower levels.
Still, they tried to take them outside when they can.
And I understand that we're talking inside. And so,
and again,
when you have kids running around and nobody's taking off a mask, that to me. And so to Ethan's things, no, I don't believe everybody is going by what we as a board voted on. So yeah, it's fair to say they are, but in actual, they're not. So that was the reason that one was added.
Along with the fact that teachers are quoting that we never voted on it. So if we vote on it, then they can't say that any longer.
But
But
my point is that we did vote on it.
We did vote on it. If it's in the protocol or the governor's mandate, then if we voted on that, it's in there already. It's just that's my guess to it.
Right, but when people have called the district office, they said it has never been voted on. So there's
Bernice, who did they
miscommunication from
speak
all
to? Because
levels.
they didn't speak to myself, and I'm pretty sure they haven't spoken to Cindy
They
either.
did not speak to me, so I'm interested. Who did they speak to?
And that's the point I'm trying to make. There's miscommunication throughout the district on so many levels.
Well,
So it sounds like an administrative and communication issue, not something that we need to address by passing the provisions of the mandate piecemeal.
Well, one thing that I would like to say and ask the board, we did prior discuss no mask in gym class. Is that correct? I mean, Joe agreed that, yes, we did vote on that on a phone line.
but that was prior to the mandate, Bernice.
Before we started school, when we had our own.
Right. And then
So the mandate
is allowing,
the
sorry,
mandate,
someone was talking.
yeah, the mandate
Sorry.
trumps our board motion at that point.
I understand that, but can we make it a that we then bring down to administration throughout that, can we please allow these kids to have a gym class without mask to the best of their ability? Because not everybody's on the same page, Matt.
Yes, what we will
We
do.
have a lot of people that constantly are telling these kids. And so,
Administratively, what we will do is we will communicate to our physical education teachers to have specific parameters to justify mask or no mask within their classes.
great.
Okay, is that agreeable?
I would like that to be brought down, yes. It'd be great. And hopefully kids are coming home more saying, yes, they were able to take it off, because that was a concern of this board with athletics.
And again, I can't guarantee that they're going to be coming home more without masks, but there'll be at least parameters to work with them to justify whether or not it is or is not.
And the point of that is that was a huge concern for this board moving into this school year, that children would not be doing sports with mask. And so in the next one, it states that, when a child or student is participating in a sport, well, to me, gym class is a sport. Can be, with their doing whatever. So I would like to see that done, yes. And then the next one, was the discussion of an exemption. We discussed at the last work session that we would have that discussion because we've never had a discussion on exemptions, whether it be religious. And I don't know how many people have read, how many board members have really read through the Department of Health order. But in that order, a lot of districts have allowed for exemptions, as it states there, if it would cause a medical condition. And so I know Delaware Valley just allowed for that exemption because they don't know if a mask over long term would cause anything. So I'm asking the board to allow for exemptions on some level for some families. And I know, Matt, and I've talked with Mr. Meir as well, that you need a medical doctor. Well, my thoughts on that is this mandate, and Matt, you just stated that, you know, this supersedes our health plan. And this mandate says nothing about requiring a doctor's note. So I'm curious, and my question would be then, are we following the state or are we following our health plan at that point?
Well, what I would say to that is, well, we're following the Department of Health's mandate. Excuse me. However, the legal guidance from our council, from various councils across the state, as well as our Department of Education and various other education groups in the state, administrative organizations, advise that when a request for a medical exemption occur, that a medical note accompanies that. Because what happens then is we would have to go through a process of either implementing, altering a child's IEP if they have one, or implementing a 504 plan, which would require specific accommodations for that student. And if that's the case, because otherwise, if it's just a random note saying, well, it impacts me in a certain way, there's so much gray area that goes along with that. It opens the door for pretty much anything to be considered a medical exemption.
But this mandate states nothing about a 504 IEP. It just strictly says that if it would cause. Now, I'm no doctor or a lawyer, and I know I haven't met these children in the district, and I don't know if it would cause. A parent knows best if it would cause something. And that's why, you know, if we're going to follow this, and why couldn't we follow that under an exemption?
Well, we would still acknowledge a medical exemption, but again,
Now, but see, the mandate states nothing about a medical doctor's signature or a medical mandate. It doesn't. And in that section, that is how it is read.
And again, going back to our discussions with local physicians and nationwide physician groups, it is recommended that a medical note be associated with that request.
And I understand that's our policy and that's people's doctor's choice, but that's not what this mandate states. So I understand. Now, there are plenty of doctors who refuse to write a mass letter because they're afraid their license will be taken. So a kid could possibly need one, but they're afraid to write one. So this gives the leeway for so much. Now, you know, I know there's misinformation within the community because I have seen, board members share on social media that administrators will be held liable and so will board members. And I wanted to clear that up. And my question, Matt, is because some school districts have had this in place since September 7th. So they're in almost a month. And my question is, has any school district been cited for not following by the Department of Health?
I'm not aware of anybody that have currently been cited, but I know the Department of Education has written notices to specific districts informing them of potential consequences that may occur. And I know specifically one within IU-19 who originally voted to allow medical exemptions without doctor's notes had their insurance carrier, their solicitors come to them and tell them that we will not cover you in the event of, you know, an illness or a lawsuit that comes about, and you are
Because of
held,
COVID, right, I understand.
and you're held personally liable.
But
And
that-
those districts, that district in particular, reversed their course of action to require a medical
Because of a
note.
fear tactic.
Well, and as
But my
did,
question is, Matt, has any school district as to this point been cited from the Department of Health?
at this point, not to my knowledge,
No.
I can't.
And I
answer that.
know,
Hey, Bernice, I have a question. So you're talking about a fear tactic, right? So take it as what it is. So what you're saying is, well, let me just ask you a question. So a fear tactic, they're willing to take your funding away. They're willing to take your insurance away. You're basically, what I should be saying is you're willing to take a chance for that to happen. So what that means is that somebody's taxes could go up twofold, threefold, whatever. The insurance for the district could go up or go out, I should say. And, you know, you're asking a question about a fear tactic. To me, that's a good enough reason to stop and say, you know, if you're asking if it's a fear tactic, so think about what you're asking. It's
But-
kind of the same thing, Bernice.
well,
It's
Joe,
really
no
is.
school has been cited.
Bernice, but a cite doesn't have to come in a month. That
It's a
citing, that
legality.
citation could happen 5 years from now or a year from now, when I'm not on the board or you're not on the board or whatever. So, you know, me personally, I'm looking at something down the road here. If you get a
But Joe, now
citation,
can I just
go
say
ahead. Go ahead. You want to go ahead?
on that part? I just wanted to say something on that. Yeah, you're right. And you know what? It could go the other way too. Like I
Sure.
look at the FDNY 20 years later, people are still
Yeah.
under the 9/11. And if they got cancer in 20 years
Well,
later, they can still settle.
That right there is a good enough reason for me
Yeah, but that's my
to
point.
not go with it because
We
there's
don't
a chance.
know what
We
is
don't
going
know.
to happen if a
Right,
kid's
you're right.
wearing a mask 8 hours a day.
You're
And
right.
that child can come and sue for throat cancer 5-10 years down the road. Also, we have already cost the district $400,000+, 400,000 because 24 kids went to cyber. There are 5 districts in the surrounding area being brought up on liabilities and lawsuits because they're not allowing parents to have a choice. So we're already in the hole $400,000 because we're not allowing parents that choice.
Well, no,
One
I just,
month, 24 students in cyber. We're at 90+ in cyber.
and Bernice, and I can speak to some of the surrounding districts, many of the districts in our intermediate unit, and I would imagine across the state, but I can't give you hardcore facts on that, but they're experiencing the same situation. And we are offering options. There's a cyber option, that they can partake in. But again, as we all agreed last year, as a result of the pandemic's initial impact, that in-person learning, we believe, is the best. And that's what we want.
There's no denying that, Matt. There's no denying that. In-person education is the best, but our cases are going through more and more. And for people to sit here and think the mask is working, this is not a health plan. It's a compliance plan. That's all this is. For any board member to sit here and say, yeah, this is a well thought out health plan, I can't help you.
Well, I'm not a physician, I'm not a medical doctor, but I take the advice of medical doctors that are much more well-versed and knowledgeable than I am. So
As do I, and
that's why I make the recommendations.
And I understand, but we should allow for some form of an exemption. And Joe, I understand and I'm grateful you're willing to have the conversation. But when we say taxes go up, they're going to go up in May because we already at 400 grand. They're going to go up because we will be with a lawsuit. We are already going to have one. So our taxes, don't raise our taxes because at this very point in time, we have an opportunity to allow for an exemption.
Well, Bernice, I don't mean to interrupt, but there is an allowance for an exemption in here, but there is a process to go through in order to approve the exemption. So the exemptions are possible, but there is a process to determine whether or not it's a legitimate exemption.
Well, if you could just help me then, Matt, where is that process in this Pennsylvania Department of Health order? Or is that our process? Because this supersedes the process.
No, and that's not necessarily our process. That is dictated by, again, if there's a medical concern, we would investigate and inquire and set up meetings with the family, the students. If we had medical documentation, then the 504 process would kick in, which is a very regimented process that we're required to follow.
But that's the school's process, because in
No, that's not
Pennsylvania
the
Department
school.
of Health
We follow-
order,
we
it
follow
states nothing,
We follow
nothing,
the legal process of that.
but that's not in the order. So I'm just asking this board to think about exemptions because they've denied religious exemptions. They're not even willing to talk about an exemption.
I'm in favor of exemptions, but I'm not in favor of exemptions when the long and short of it is that anybody can write a note and get around the mask mandate, because then in effect, you have no mask mandate. And that just cannot be suitable under this, under the mandate that we're operating under. And there's a difference between taxes going up $400,000 a year and possibly doubling because we lose state funding.
Ethan, I appreciate you speaking up. It's hard when it's virtual, but I do appreciate the conversation. There's that misconcept of losing funding because everyone saw the Secretary of Health, that video that was sent out that was live. It was repeated. Doug Marciano and Mastriano had that live. It was repeated and repeated and repeated by everyone there. You will not lose funding. You will not. But one thing, so everybody throws this out there and it's in the community, we're going to lose funding. There is no loss of funding, but we are losing our children through the cyber program. And so that was an exemption allowed. I don't see an exemption, Ethan, any difference in this Department of Health order than it states where an individual can walk into a building here without a mask and they cannot be harassed, they cannot be thrown out. So if a student was to walk in with a mask, they cannot be segregated, none of that. So, you have all of this where what's the difference? If a kid was to walk in tomorrow with no mask, we can't refuse, we can't do any of that. That's my point is this mandate has set it up. I can't help it if they wrote it in 5 minutes without taking that into consideration under the exemptions form. But as it is written, it clearly states if wearing a face covering would cause. And if my child, I could clearly write an exemption tomorrow and say, yes, it would. My kid comes home with bloody noses last year and headaches. I have a doctor here that says there are 32 adverse health effects from wearing a mask for long term. Our kids have been in masks for 2 years almost. And you're telling me that's not long-term effects? It's going to have long-term effects. So what we're saying is 5 years from now, sue the district because Johnny has now throat cancer or whatever. Tonsils need out. I don't know, but we're not allowing for the parent to make that best decision. So what we're saying is one size fits all here. and it doesn't. And that's the frustrating part, is that we can sit here and say, yep, this is great for everybody. It's not. This Pennsylvania Department of Health, not my fault. They wrote it this way, but they did. And if we go to the way it's written, it's if it would cause. Well, there's a lot of parents out there that think it would cause an effect on their child. And who am I to say that? It wouldn't.
From an organizational standpoint, and in order to maintain consistency, we need a process to filter those requests and to be, again, as consistent as we possibly can. And at the same time, work with legal counsel, medical counsel, et cetera, to ensure we're making the best possible decision we can for the kid. So I'm not trying to belabor the point anymore.
And I don't want to either. So I just want to hear what you're saying. So if a parent was to write in an exemption form, say tomorrow, that says, yes, my child has been coming home with headaches every day for a week, it would cause this.
Well, we don't know that it's necessarily from school. Maybe it's from home. Maybe it's from the allergies in the yard. I don't know that. That's why we would seek medical advice or a medical note from a doctor to say that this child has experienced these symptoms. And then we would put the 504 process in place as a result to determine what accommodations may need to be enforced or provided for the child to get through the school day.
And I understand that. But again, Matt, we're requiring a doctor's note. This mandate is not requiring a doctor's note.
Okay, but how else do we regulate it?
Let the parent decide.
Well, then that is a slippery slope that we cannot come back from if we open the door.
And what do you mean by that? Do you mind if
I woke up and I had a headache. Okay, well, what's the headache from? I feel like I don't need to wear a mask today. How do we ignore that request then?
I think we leave it in the parents' hands. That's where I've always been. That's where I think it's the best choice for this district.
I understand that, but it goes against all of the guidance and recommendations.
But then we'll just put it on the record that it's going against the mandate that is written here. That's what it's going against. Our policy is going against how it is written. So just put it on the record because that's what it is. We're going to pick and choose what parts we want to follow. And I agree with you, Matt. I don't want to belabor this, but I'm fighting for those parents to have that choice.
I understand that, but I also do believe that these two line items are redundant in that we follow the mandate as it is written. And again,
but then again, that's
the physical education component we can refine, and we will go back to our phys ed department and work with them to have more clear communication and guidelines.
Great. I have one question, since this is a work session, and if everybody was here, I would ask that question. Did anyone get to read the legal advice that was sent out by Prince Law? Any board member had the opportunity to read that?
I was able to read it.
Dana, you're the only one?
I read it.
Okay.
I also saw it.
Okay, good. Yeah, just curious, because that's where we're going to be at. So just, want to let you know.
I also read the legal advice from the education attorneys that we work with on everything. And their advice is pretty much 180 degrees from that.
Yeah.
And I've listened to what Attorney Mears has said as well.
Right.
And, we listen to legal advice in a lot of contexts, and We generally don't go out there and search for the result that we want and then use that.
Ethan, and I appreciate that. And it's, not everybody is going to agree with the same. So no, I did not go out and search. I'm trying to do the best and get knowledge by reading the mandate myself, because I'm sure there's some board members who haven't even read the mandate, the Pennsylvania Department of Health order. And I'm trying to do the best information for our public. And so, yes, I am going to find a lawyer who is willing to be for the people and their choice, and a parent's choice, because I don't know what's best for these kids, nor does any other board member who has never met them. So yes, I'm doing my homework. But I thank you, Ethan, for your comment. I do. I appreciate that ability to talk, because this is a work session. So thank you for that. And great, we'll continue. We'll see where this ends up.
Okay, moving along to number 14 is our district organizational chart. We are required to approve that each year. Number 15.
Matt, I have something to say about that one, a question about that.
Yes.
Why is the maintenance supervisors and custodial staff under the answer to business managers? Why are they not answering to the building principals? Because they're the ones who are in charge of their school. And I don't understand why they would go to the business manager and not to the building principal.
Yes, well, they actually fall under, yes, and Rose and I noticed that today, that the line should have a connection to those building principals, and we are going to adjust that. And primarily, they all fall under myself as well, which they do currently, but the line should have extended. So we will adjust that.
Thank you.
Matt, before we can move forward, can I just ask 3 more questions that were about COVID and all of that, that I had people ask me? Can you just clarify what qualifies a close contact to be quarantined? Because I think there's some miscommunication or information out in the public.
Yeah, essentially the mitigation chart that we put out there lays it out for everybody. But if both students are masked, they do not, for the entirety of the time they're together, or with the positive person, they don't have to quarantine. If someone is vaccinated in a close contact, they're to monitor their symptoms, but they do not have to quarantine. And going back to the old 6 feet, for 15 minutes, primarily a lot of our quarantines have come from either our athletic situations or our cafeteria situations where our students are in close proximity for an extended period of time without masks.
Okay, one question. I had a parent ask about their child was wearing a full face shield, but yet they still had a quarantine. So what?
Yes, according to it has to be a tight, secure fitting mask, not a face shield. Now, face shields are an acceptable form of face coverings, according to the Department of Health, but they're not recommended in terms of preventing quarantines.
So why then, for our 504s and things like that, why are we even offering the shield then if it's not qualified?
They believe it is a layer of protection, but not sufficient enough to limit a quarantine.
I guess that makes sense. Okay, and one more. I just had 2 more quick ones. I know you've had meetings with the Wayne Memorial Hospital. Has they discussed anything about weekly testing at this point?
We have discussed, well, not necessarily in our meetings with Wayne Memorial. more so with our meetings with the intermediate unit and other districts. The Department of Education does have a program that they're looking at. However, at this point, the few districts that have signed up have experienced an extraordinary amount of time and energy that goes into being able to offer that in-house. It puts an exorbitant amount of work on the school nurses, apparently. The documentation that goes along with it is very laborious. I'm not saying it's not going to be beneficial by any means, but they're still working through a lot of kinks at this point and trying to iron out and streamline some of this so that it could be efficient. And right now it's not very efficient from a school district standpoint.
Great, thank you. And my last one was, I know with the Biden administration, when they came out with the mandated vaccination for employees, employers over 100, has there been talk about that within those community?
No, we've received word that, public school districts, and I don't know about all public employers, but currently, I think many public employers do not fall under that requirement.
Okay, thank you. I just wanted that to be cleared up. I had some questions. Thank you.
I have a question. Just about the test, Matt. What type of test is it? Are you spitting in a cup or you're sticking the Q-tip?
No, it would be a swab. I believe they're rapid tests, and they would so instead of a student having to quarantine, they would be required to come in daily to test. So they'd have to go to the school nurse, get swabbed, and then we'd have to submit that information to Department of Health or whoever would analyze the results and then get that information back. So, and again, from a logistics standpoint, there's still a lot to learn on that front as to how we can do it.
We don't have the time to do that for every student every week. I'm not going to have somebody stick a swab up their nose. So
right.
That's a no for me. So
if we get to a point where we think it would be manageable and effective, we'll definitely consider it and, potentially propose it. But at this point, I'm not considering it because of some of the commentary I've heard.
Matt, with all these positive cases, and now we'll have more people with antibodies, I had someone ask, if you have the antibodies, do you have to wear a mask?
Yes. Vaccinated individuals, antibodies, anybody with the antibodies still has to wear a mask.
And the reason behind that, I'm just curious.
Because you could still be contagious to others. So the antibodies don't prevent you from getting the sickness again or the virus again, neither does the vaccination itself. It just minimizes the impact that it may have on a particular individual.
Thanks.
Okay, are we good to move on? All right, number 15, we have transportation drivers and substitutes. As listed there. Moving along, that's a good thing. We're getting some more drivers available, which is positive, although it's still limited. So we're welcoming as many as we can get. Number 16, we do have 2 contracts to the Lincoln Jackson Academy, as well as an extension for the high school, middle school. I'm sorry, letter B is not an extension. That's a new van run. Letter number 17 are the extensions to current van runs as listed there. So number 18, we do have quite a bit of policies that we are required by the state to annually review. There are only 2 that actually had some very subtle language changes that came from the state. Cindy, if you don't mind jumping in here for a second, I believe one was for weapons and one was for,
The hazing policy.
yes, the hazing policy.
Yeah, so the language, there's very little language changes. It's pretty subtle in nature, but it was based on the recommendations of PSBA. The other items that are listed are just our annual review. And as Dr. Barrett said, there are no changes to those policies at all.
And those are all listed on our board docs on our website. Number 19, we have a facilities use request. This is for our after-school Shine program with the Workforce Alliance Group. That's our after-school STEM program. The next several items are contracts with external agencies for special education services, for alternative education services, drug and alcohol treatment, et cetera. And these are groups that we've been working with the last several years, with the exception, I believe, Lincoln Jackson is within the last year or so. That's an alternative placement for students who may be expelled for whatever reason might be, disciplinary reasons. LearnWell is for hospitalized students. PATH is for drug and alcohol treatment, counseling services. GRAM is for special education services. Scrolling down to 24, Child Service Center, again, therapeutic special education services. And then moving to 25, personnel.
Matt, can you just tell me, where is that Lincoln Jackson Academy? Does anyone know?
That is in the Scranton School District. That is an
Okay.
extension of Scranton.
And that Children's Service Center, where is that one?
That is the, Cindy, can you hop in there with that one?
Just trying to find out, like, when a van driver drives them, like, where are we talking distance and the location of it?
It depends, Bernice. We have had children in the past go all the way down as far as Wilkes-Barre. So it's depending on where the services are available and what the student's need is.
But that's at Children's Service Center, Cindy?
Yeah.
Okay. All right, thank you.
Number 25, personnel. Letter A is the substitute list. Thankfully, we did acquire some subs in various areas: guest teachers, nurses, teachers' aides, secretaries, etc. Letter B and letter C. These are adjustments to our school police officers' hourly rate, as well as the rate for our school security that we use for after-school events and supplemental security if necessary during the school day. The school police officers' salary has not been adjusted since we started the program back in, I believe, 2013. So,
And can you say what's the increase from what to what?
it was $30. We're looking to go to $31.50.
Okay.
And then it's been several years also for the security group, and it was 19 to go to 20.
That one I knew. Okay, thank you.
So Matt, B is for like the hourly, like 8 hours, they're there all day, right?
Correct.
And then C is like they have to cover a football game or something, right?
Exactly, correct. Letter D is a resignation for a paraprofessional. Letter E is a resignation for a vocal director. Letter F is a long-term substitute. That's the appointment at the middle school to fill the vacancy that was there as a result of a FMLA / sabbatical for the school year. And then letter G are replacements for the retirement or resignation for the paraprofessional. And then the other is as a result of a current paraprofessional taking another position, leaving this position open. So those are the two recommendations there.
Just a question for you, Matt. From last year, we added 4 aides. Was that correct? At the end of the year, how many did we add there towards the end?
I don't believe we added a total of 4. I think we shifted as a result of a retirement or resignation.
Right, no, I know, but we hired 4 full-time aides at this point. So this would make us up to 6, correct?
I don't have those numbers.
Okay.
I'm sorry.
That's right. I just curious on that. Thank you.
I think it was 3. We hired 3 at the start of this year. And then it's these 2 additional. So I think it's a total of 5.
Okay, and Rose, question for you, because I know some of that ESSER funding, did some of that go to hiring those positions for the first year, or no?
No,
Okay.
actually, most of them were either the 2 on here, one is a retirement and one
Right.
is a transfer. The 3 that were previous, 2 of them were retirements, if I remember, and the other one was a new position that we had added into the
Okay.
21-22 budget.
All right, great. Thank you.
And that addition was due to a student IEP need. Letter B are advisor appointments. I'm sorry, letter H, not letter B, excuse me. Letter I are winter coaches as listed. And then we have middle school SAP team additions. These fill out the last 2 spots for the middle school. So they have a full team. And now we have letter K volunteers for FCCLA. And then we have-
Matt, we haven't had anyone do the varsity advisor position yet, have we, the assistant?
Not the assistant. We're still searching and keeping active on that.
Okay, and so what happens if we don't have anyone?
Well, we can further discuss that for sure.
Okay.
If we want to absorb that or break it up somehow, we can definitely discuss that.
Okay,
And then we have our informational items, number 26 as listed. There is a student teacher for October through December at Evergreen, and then our correspondence reports, etc. And that's our agenda. Does anybody have any other questions or concerns regarding that?
So just to clarify, relative to 12 and 13, your recommendation is?
are you asking me, Bill, or Matt?
Oh.
I know you're not asking me.
I'm asking Matt.
I'll be honest with you. I think it's redundant because we do follow that as it's worded, which is the language right from the Department of Health's mandate. I still am not certain as to the purpose of the vote and how it would impact us in either way.
Well, if we voted for it, Bill, then we would allow it without a doctor's note. That's the only thing that would
Right.
allow for it. That's it, because that's what the mandate says.
My concern is that when I watch, the news and watch what's going on relative to the pandemic, it seems to me that the information that I've been gathering, so to speak, or that I hear, is that the consensus of the medical community, you talked about the CDC comes out with guidelines. The Harvard Medical School has guidelines. Other places like the Harvard Medical School, the Cleveland Clinic, et cetera, you hear what they say. And they basically say that the consequences of getting a COVID infection could be much more dangerous than ignoring mitigation efforts. And, those are the four things which we all know have been repeated many times: mask wearing, washing hands, socially distancing, and getting vaccinated. And just earlier this week, I was watching one of the morning shows, or the news shows, and it said the CDC did a study, or they came out with a statement that masks work in slowing the spread. There was a study in Arizona of 2 different school districts, or at least schools, one where students were wearing masks and one where they weren't. And then the districts where they weren't wearing masks, there were many more infections. So, the data seem to show that also that most of the people who are sick right now and are dying of COVID are unvaccinated people, and that they have they can spread the disease. So if there are people who are unmasked, they have the potential to spread the virus. And I agree. I understand what's been said in the last meetings we've had when we had people in the auditorium. I understand what you're saying, Bernice. Parents are frustrated. Parents certainly have the right to make decisions for their children. But the question is, whether they have the right, if these facts are true, that, the spread can happen, do they have the right to make a choice that could affect another child? That's what bothers me about it.
Yeah, Bill, I love you. And problem number 1, stop watching the news. Okay. Number 2, thank you for saying that, but that's what I would say. Stop watching the news. Because, and this is where my frustration is, Bill.
Yeah.
I have been in close contact with Bucks County School District, and there are 3 school districts down there that have allowed for such exemptions as this. Now, each school, one has 18,000 students. They've been in school from the very beginning, and they have exempted under the Department of Health's order if it would cause. They are still in school. Cases are not going through the roof. 18,000 students. Penn Ridge, all of these districts, Delaware Valley is allowing this as well. So I am just blown away if these districts can do it with 18,000 students. How can we not do it with 1,800? That's just my confusion. I don't get it. So that's
Bernice, can I jump in? I've heard everybody and their discussions, and one of the things that jumped out to me, and this is in number 12, is Matt Barrett. That is, you had mentioned that in our own district, where the cases have come up are in 2 areas. 1 are sports, and 2 in the cafeteria. So in number 12, 3H, that is where it's not mandatory to wear it in a sports event. So there's one area where we're running into COVID cases. The other area in G, where in the cafeteria where you're trying to eat. Another area where we're getting hit with COVID. So my thought is right now, where the highest exposure is and that they're relaxing the rule is where the cases are being encountered within our district. So right now, I want to keep the kids in the school. I want to follow the mandate the way it's written. I don't want to misinterpret. I want to follow right now medical guidelines. The American Pediatrics also endorses masks at this point, all of these medical. So I'm going to follow the professionals right now who are in the industry. And that's just how I feel. And I don't want to interpret number 13 either. I think there's a vetting process. I don't want to open up the floodgates. If that's what it means, where it's written the way it is, if we have to add that extra vetting process, so be it. That's what we're going to need to do. And I feel if I think we need to have a medical professional come in and endorse and say, yes, this is the reason. And it does say would. Would is a very open, would doesn't mean it's going to, it doesn't mean it's not going to. So that word right there can be anything. So I just wanted to give my opinion on both sides.
And that's
Okay.
the point I'm trying to make. And Jeff, I'm grateful you spoke up, but you know, I'd have to say something. I would love to say it's our athletics and our cafeterias with no walls or no mask. But let's be real. We have 1,800 people at a football game. They're going out without masks. So we can't really say it's our athletes and our lunchrooms that is causing this. So I just have to say that because I think.
Bernice, but what I heard
Crazy.
Matt mention was that where our district currently has had their issues were in those two areas. Okay. So
I think that's the only place they can close contact. That's not where people are
Correct.
getting it from.
Yeah, that's the reason why they're being quarantined, because they're
Right.
in contact, because they're not wearing a mask at those things. My question then is, how many have actually contracted the virus after they've been quarantined?
And that is a valid point, and I do understand that. However, we have been experiencing, especially in the last few weeks, that the students we have quarantined that have had to quarantine as a result of being a close contact in those areas have been testing positive. Now, can we distinctly determine that it's as a result of that interaction? Maybe not, but there's a good correlation to it.
Well, also a lot of these kids are doing cheer, football,
Correct.
all different
Exactly.
sports. So
Exactly. But
it would
again,
take, you know,
again, the whole point
we're
is
going to look at one, we got to look at it all.
the whole point is to mitigate the spread as best we can and to minimize quarantines the best we can, and to keep, most importantly, kids in the building.
And I love that, you know, all our administrators send out emails saying, let's keep our kids in school. But it makes no sense when we have 1,800 people or 800 at a football game. So for them to say that us wearing masks in school is going to keep us in school, to me, that doesn't make sense.
I
That's not the
understand
only
that.
area that these children are at. They're at churches, no mask. They're everywhere without a mask. The only place they got to wear a mask is in school. So to say it's keeping them in school, that's not really true.
It certainly sounds like with the numbers with what Dr. Barrett just said, that you can infer that those cases, if they're tied to those rooms that they're not wearing masks, it certainly seems like it makes a difference.
I don't think so, because in the classroom, that's where they're wearing masks. Am I correct? Right. And half of these kids don't eat together. You know, they're all moving and shaking. So I'd have to say, no, then maybe masks aren't working, would be my argument. Because if they're wearing them in the classroom and you have a classroom all out, well, the masks aren't working. But that's me. So, okay. So Bill, are you ready to do the block? Is there anybody that wants something left out? Bill, you're muted.
It would seem that 12 and 13 should be voted on separately. Am I correct?
I agree.
If we do a
Sorry.
block motion.
However you all want to do it is good with me.
Well, I'm going to be very clear with how I vote and why I vote and where I'm intending my vote to be, because these are very loaded questions. So my vote is going to be a certain way with very specific reasonings behind the vote and where my vote is intended. So it could be a certain way, but it doesn't mean it's going to be this, this, and this. So I'm going to be very clear on that when I do make my vote.
Jeff, I
So-
just
so
want to be
what-
clear. Do you want them pulled out? Is that what you're saying?
If I vote one way or the other, I'm going to explain why I voted the way I did so that it's on record and very clear. I don't want a blanket yes or no, and then, okay, we're going to run with it because this is the way they voted. It's going to be specific. And if it can't be specific, then it's going to probably be I'm going to abstain because
So no, Jeff,
can't
my
make it-
question is, do you want them pulled out? That's what I'm not understanding.
well, I don't want
Put it on
misinterpretation.
independently.
No, the idea of, if we do a,
Well, yeah, it would be voted individually so that
Yes.
everybody has a reason or has a floor to explain themselves very clearly on which way they voted and why.
Yes, I'm fine with that. Yes, then Bill, we can pull out 12 and 13. Jeff, do you want individual roll call and then explain at that point?
Yeah, that's, I mean, because again, everybody should be very clear and have a platform to explain which way they go and why. That's the way I feel.
Okay, and I'm fine with that. Absolutely.
I think most of us have already sort of given our reasons. And I think it's pretty predictable at this point, how the vote will go. But the idea of leaving them out would be to do just that, to vote separately, because if we did a consent block with all of the items, they would all pass or fail, depending on the vote. So
Correct.
that's why we would leave anyone.
Yeah, so that's good, right?
Yes, and any other.
Okay, I'm good with that.
And if there were any other, usually the way this is done is that any member can ask for any of the items to be left out for any, like if there are others besides that, 12 and 13, they can, any member can say, I would like number whatever,
Right, sure. That's what I was asking.
Yeah, right.
Folks, is there anything else? Any coaches or anything like that that anybody wants out?
So we would have to end the work session and then start the regular.
Correct. Yes. So Bill, you're good with the motion?
May I interject, please, before we even get into that? So just for clarification, so Bernice, it was stated that, at least for 13 with the medical exemption, your intention would be to allow for any medical exemption without a doctor's note, correct?
An exemption without a doctor's.
Okay, but then to clarify further, if that is voted down, the way the line item is written, anybody who voted against it would be voting against the mandate. So I think there needs to be some strong clarification there as to what exactly is.
Right. So this would be
Which would mean
to allow a parent's choice if it would be harmful for them. We're not voting down the mandate. We're voting to allow written according to the mandate, that as it is written
Then
would
this,
allow.
This is Matt Meir. I've listened to everything. I think if that's Bernice's intent with regard to paragraph 13, then the motion as it's written needs to be amended to state that a doctor's note will not be required.
Okay.
That needs to be put into the motion, that a doctor's note will not be required, because I too agree, and I've spoken with Bernice about this, that this is redundant, that we have been following the order since it came out September 7th. And I agree with what Ethan said earlier, that we're approving something that's already in place. Upon hearing Bernice a couple of minutes ago slip in there that this would not require a medical note, that is not how paragraph 13 is written. Paragraph 13 states it's in accordance with the order. So if she wants it to be without a medical doctor's note, then she would have to amend that motion when she makes it so that everybody is clear on what you're voting on.
Mr. Meir, can I just ask a question? The Department of Health does not state anywhere that it needs a doctor's requirement. Is that correct?
Correct.
Okay. So I am right when we say we are following the department. If I heard you right, we are following the order because it states that you don't need a doctor's note.
Doesn't state that you don't need a doctor's note.
Well, can you point out to me then on the order itself that where it does state that you need a doctor's note?
I already answered that question. It doesn't.
and I'm sorry, maybe you didn't understand what I was saying. It doesn't say that it needs a doctor's note, correct?
It does not say that you need a doctor's
Not the
note.
motion, the order.
Yeah, that's the language from the order that you presented the other day, right? This is the language, right?
Right, but the order does not state that it needs a doctor's note. That's what I was asking.
I already answered that, correct.
And you said, no, it does not need a doctor's.
It
No.
doesn't state that in the order, that's correct.
Yeah, and he's saying that it doesn't state that. It doesn't specifically list it one way or another.
Correct. Doesn't say it the other way either.
Correct.
So we would have to clarify what exactly we are going to follow, is my
I'm just saying that motion, when Bernice tries to say this would mean it doesn't mean a doctor's note, she's got to amend that motion to state, because it is her motion that she presented here to put on here. She has to amend that motion to say that the school district would allow this exception without a medical doctor's note.
But Matt, can I say, Mr. Mayor, can I say it?
You can amend the motion under Robert's.
No.
Rules of Order.
My question is, I guess I'm just confused because the order doesn't say it needs a doctor's note. So I'm confused at what you want me to say because this is the order.
Right, so you're trying to determine who states what would cause. Well, that's a medical doctor's note. So if you don't want them to be required, you seem to be doing an end around here trying to state that just by approving this, which we're already under, that's going to allow parents to just say, this may cause a problem. So
Right.
that's not what your motion says, Bernice. So you're going to, by doing it this way, without amending it to say a medical doctor's note would not be required,
Okay.
you're going to create even more confusion than you appear to be attempting or claim to be attempting to clear up.
Okay, I just wanted to clear up the confusion because I was confused. Nobody else, just I was, of what you want me to say.
No, I believe everybody else was a little confused based upon me listening to the discussion here. And I do believe most board members have read the health order.
I'm going to go with there could be a possible two that haven't. So I'll agree to disagree, but that's okay.
I know, I just want to clarify that, you know, so there is not confusion. You should amend your motion to, instead of just slipping in there and saying, well, that'll mean any parent can exempt it, because that's an end around over the order that we've been following since September 7th, as required under the law. So that's
End around that Delaware Valley just did. So I'm just stating that that's where, you know, I'd like to follow suit as some other brave districts, but that's me. Okay, so I understand what you're saying. So I will read that one. And all I will say, can I just read it as listed, but add that a doctor's note would not be required? Is that correct, Mr. Mayor?
I think that would clearly delineate the motion you are attempting to make with that statement. Yes, I believe that would clearly delineate the motion you're attempting to make.
Okay. So we're good.
So how does that affect what the superintendent said about, he brought up the idea of us going against what we already, in other words, Attorney Muir, what do no votes on these mean? Are we doing what we're?
Well, no. If she
amends it,
if she amends the 13 to include that, then the no vote means you need a medical doctor's note. That's why there's redundancy here. And that's why these are creating confusion, because the orders have been followed by the district. And as far as 12 goes, if there are specific instances of one gym class requiring masks because for certain stuff, that's an administration issue that needs to go up through that channel to be handled.
I actually don't even know how to vote on number 12 because it doesn't appear to change anything.
And
so, I don't even understand why we're doing it.
Ethan, that was my question to Mr. Meir.
Yep. That wasn't your question to
No,
me.
My question to you
I
is,
didn't even know why we were doing either of these because we've been following them.
because I spoke to you the other day
And you indicated that there was a specific instance with a
and you
student
suggested that, yes.
that called you, or a parent called you and said that a child was having to run a mask, and you said it was only limited to the high school, I think.
No, I didn't say the high school. No, I didn't say that.
Or some other schools were doing it or something, and I was confused because that would be an issue to me, that if a child, that it would run, maybe it's a principal talking to a gym teacher, or there has to be some subjectivity under this order for the gym teachers who are actually in the classroom to be able to determine whether, it's an aerobic exercise, or if they're sitting them all down and talking about the exercise they're going to do, whether they have to wear masks and then take them off. So I agree that it's all very redundant, but the way agendas work, Bernice wanted this on here.
And I did, Mr. Mayor, because, when you have people calling into the district office and their response is it was never voted on, well, then there's miscommunication throughout the district.
Right, because
So my hopes was to get everyone on the same page.
And Bernice, I don't believe that statement's accurate, that they called the district office and that comment was made, because it wasn't with Cindy, myself, and I can't speak for Rose, but I can't speak for building principals either, but that was never brought to my attention.
And I understand, I'm just trying to get everyone on the same page. That's it.
Well,
By that intention. So
we
if you want to remove that, great, and it goes through the chain of command, I'm fine with that as well.
remove what?
The number 12.
Well, technically they could both be removed. If they are redundant and we've already approved it.
I would be happy to vote on 13, but that's just me for the record.
And if it's a matter of communication, then all we need to do is communicate. In other words, we don't need to vote on them again. We just say, well, yes, if someone says you didn't vote on them, you can say, well, you're wrong. We did vote on them.
Right. And Bill, I would like to keep 13 in. That's just for me for the record. But if you want to remove 12, I'm fine with that.
Well, it's what I guess.
Okay. So if you guys want to go ahead, we can move forward. Are we good?
Well, are you removing 12, Bernice?
Yeah. If you want, that's fine. We can do that.
I believe that can be done according to Robert's rules, correct, Attorney Meir? In other words, if Bernice wants to drop one of these.
Yeah, that's all this stuff is, somebody has to make this as a motion for it even to come onto the table.
Right.
To remove an item, or I know, I often.
Remove 12, Bill.
Pardon me?
Just remove 12. It has to be made into a motion and then leave the rest. Okay, and we'll do a block.
So we'll do the block except for 12 and 13, and then when 12 comes, you will move to remove it.
Okay, and then do 13 and we'll be good.
And you will modify 13 then.
I'm
Obviously.
sorry, say that again?
And I believe you will modify 13 at that point? Or
Yes, yes, I will.
Okay. Okay, I guess we got that clear.
Okay, you're clear, you're good?
I think I am, but okay, I think. Yeah, the meeting has to be officially started and all that, right?
Right. Are we ready?
I guess everybody's ready.
Okay.
I'm assuming.
Dr. Barrett, you're ready? Okay, so let me just get my paper together real quick. Give me 1 second. I'm missing my first page. Okay, hold on. All right. Okay, Rose, are you ready? We're good? Okay.
I'm ready when you are.
Okay, good. I would like to call this meeting to order. If we could please stand for a prayer followed by the Pledge of Allegiance. Heavenly Father, I just thank you. I thank you for this community. I pray that this is Breast Cancer Awareness Month, that you will be with anyone that is struggling through that, Lord, and ask for healing on their bodies. I just thank you and I praise you and give you all the glory. Amen. I pledge allegiance to the flag of the United States of America and to the republic
To the republic
stands
for which it stands,
nation
one nation, under God,
indivisible,
indivisible,
with liberty,
liberty,
justice,
and justice for all.
Miss Emmett, could we have roll call, please?
Yes, Mrs. Fiorella,
Here.
Mr. Hoke,
Here. Here.
Mr. Gogalski,
Here.
Mrs. DeCiato,
Here.
Mr. Enslin,
Here.
Mr. Gershi,
Here.
Mr. Gambita,
Here.
Mr. Auckland,
Here.
Mr. Wood,
Here.
Attorney Meir,
Here.
Dr. Barrett,
Here.
Dr. LaRosa,
Here.
and Miss Emmett is here. Mrs. Fiorella, you have 9 board members present.
Thank you. Can I have a motion for number 5, please?
Madam President, are we going to do those separately from the block? Or do you want to include them? I think the last meeting we included those in the block motion, but.
Okay, if you want to, then let's just go to public recognition.
Or we could do them then, whatever.
It doesn't matter. We can add them all together, Bill. That's fine.
Okay, whatever works.
Yep, we're good.
Okay, tonight for public recognition, I do have 2 statements to read that came in through the public comment. And then we also have 2 individuals who are on our webcast tonight who will speak. I'll do the readings of the 2 that came in to be read. I'll do those first, and then we'll open up one at a time, the 2 individuals that are going to speak. So the first email that came in, it was from Angelica Rickner. And she has a topic of concern is having virtual learning available for those who have to quarantine for 2 weeks due to COVID exposure. Her son was recently out for 4 days due to fever and sore throat. We did get him COVID tested before sending him back to school. However, he got really behind in those 4 days, and the teachers did not have the time to go over what was taught during that time. Luckily, he did have a friend who was able to help him out and get him caught up on things. However, if he did have COVID and had to be out for an additional 2 weeks, there was no way he could have gotten up to speed with what was being taught in class. COVID has affected learning in the classroom, and she thinks that we need to make amendments for that, such as having virtual classroom learning always available for quarantining purposes.
Rose, I could speak to that. We have been discussing that administratively. We're implementing, because we were not expecting this level of transmission, I guess, and the amount of quarantines at this point, especially with the younger population. However, that being said, we are looking to expand the levels of tutoring that each student would be available to students who are quarantined. We're looking to do some more, hopefully, live interaction with those students, touching base with the families, phone calls, emails, et cetera, trying to make sure that those students are involved as much as possible. We're trying to balance that with, we had several issues with our Google live stream that we're still working to shore up and trying to find the best possible solution, but we would like to start to incorporate more interactivity with the classrooms.
Okay, thank you. The second comment came in from Dr. Amanda Johnson. She said her topic is protocols for Western Wayne School District as children that are detained at the U.S. border are being moved to Pennsylvania. Considering the Association of School Boards, Attorney General Garland's recent statements about parents who speak at school board meetings, she wanted to know what protocols does Western Wayne have in place currently?
The first portion of that, we have federal and state requirements to follow when it comes to homeless students. It's called the McKinney-Vento Act, that we follow, have a bid process, best interest determination for each student, and how that looks. But we would follow those guidelines, and if we're obligated to admit the students, we do so and provide them with the necessary resources available. The second part I cannot speak to necessarily because I'm not sure exactly what those comments were by the Attorney General. But I am aware of some issues at the federal level where I know the FBI was asked to investigate several scenarios and become more involved with some of the incidents that have been occurring with school board members and at school board meetings across the nation. But again, we try to put in the necessary security at each meeting. We try to provide an atmosphere that's as non-combative as possible, but open. I really can't speak much more to that because I'm not familiar with what it is exactly she's asking.
Okay, thank you. The next we have a person who is going to speak, Mr. Robert Hess. If Mr. Seaman, if you can allow him into the meeting to unmute. This may take a few seconds, so we'll just wait for him to come on.
Okay, I've promoted him. I'm just looking for him to pop back in here. There he is, right there. All right, Mr. Hess, you can unmute.
Hello. So my name is Robert Hess, and I have two sons who attend Evergreen Elementary School. And I just have a few quick comments and then a couple questions for you guys. So first off, I know at the last board meeting, it was mentioned, and even in this board meeting, encouraged to do research and look at the American Academy of Pediatrics. And I know Mr. Gershie just mentioned a few things that he heard on cable news that aren't necessarily backed by facts, because I did go do the research after the last board meeting. And according to the American Academy of Pediatrics and the CDC, there have been over 5.9 million children under the age of 18 that tested positive for COVID. And of those children, the percentage that have died is 0.00008%. And the hospitalization rates, according to the American Academy of Pediatrics, is less than 1%. Now, I know that you guys have mentioned in the past fear of being sued over a child contracting COVID in the district, which, the severity of the disease is an anomaly. So I don't understand the continuation of the charade of mask wearing. As I've mentioned in the past, adults who are at risk or feel they need additional protection from the virus can go get vaccinated or wear a silicone sealed N95. And putting up with these mandates is essentially treating children as though they are sick or at a substantial risk of being hospitalized or dying due to COVID. That kind of draws parallels to factitious disorder imposed on another, formerly known as Munchausen syndrome by proxy. Now, I know, like I mentioned, you guys are in fear of being sued if a child gets COVID and they can miraculously prove that it came from the school. But what I'd be more concerned with are things that Bernice has mentioned, such as the longstanding effects of wearing masks, or if parents start being able to prove that the school district was somehow, complicit in a mental disorder that is given to their children by essentially diagnosing them with a disease, being that that's where the mandate came from, was initially put in place to quarantine individuals and mask individuals who have been proven to be sick, not the healthy population. So with that being said, I just wanted to clarify a couple things. Dr. Barrett, maybe you can help me out on this one. If the order doesn't state that it needs a doctor's note, the district isn't currently following the order because you're not allowing me to write that my child is experiencing adverse mental or medical conditions. So are you, meaning the district, adding to the mandate as you see fit?
No, that's not accurate. Again, we follow a procedure that if that is the case, that the parent would request that medical exemption, we would require documentation though from a medical professional to guide us through that process to determine what accommodations the student would specifically need as a result of their disability or health condition. So again, that's called Section 504 of the Rehabilitation Act, which schools are required to follow.
Okay, I understand what you said there, but in looking at the mandate, the verbiage from the mandate that you guys claim to be following to the letter says for individuals who state that they have a medical condition, mental health condition, or disability, not for individuals whose doctors state. Okay, so just the individual stating such should suffice. Is that not correct? Is that what you're telling me, that that's not accurate, that the mandate would be wrong, or that you guys are just, you know, changing it to, or changing your own district requirements, not necessarily the mandates superseding?
Again, I understand your thought process. However,
it's not my thought process. It's written in the mandate. I didn't come up with it. The state did, and they gave you guys the directive to follow it.
That specifically is not written in the mandate, but the process that we do enact is in order to maintain consistency and have proper documentation so that we can follow the necessary protocol and precautions that we need to on a case-by-case basis, given the student need.
Was that ever voted on by the board, that process, or voted on by the district that process would be implemented in regards to face coverings themselves in this section of the mandate, or is that something that has been established prior with other issues and you're just arbitrarily placing it on this as well?
No, we do that for other issues as well. If a student has a concussion, if a student comes in with diabetes, there are specific plans in place that we would make for those students and meet regularly with a team, including the student and the families.
Okay, but what I'm asking is, at what point was this implemented for masks themselves? Or was that not established? That's kind of an interpretation.
Well, being that is the procedures that we have followed and are required to follow, and considering what we are working under the order with, that is both the legal and medical guidance that we've been following.
I know it's what you've been following, but it's not what the state has recommended. They stated this in the mandate, and you guys are using that as maybe like a companion to the mandate. Next, the other thing, I know Ethan Wood earlier said that we could lose funding. Did the state come down and convey to you that funding decisions would be determined based off of districts following the masking mandate?
Yes, there has been some conversation from state agencies that funding may be impacted. They didn't say it definitely will. It's definitely a concern, but our decisions aren't necessarily based off of that. We want to make sure that we're providing a safe and secure environment for all of our students, and that's what our decisions are based off of. But utilizing the guidance we have from various agencies and try to make the best informed decision.
Okay, so it's not based off of funding, but it's also not based off of the statistical data on the impact that COVID has on children, because it has virtually no impact whatsoever. I guess I'm just a little confused as to that.
I would disagree with that. If you looked at our current numbers that have increased exponentially in the last several weeks with children from especially ages 12 to 18, it's grown over 30%.
What has the hospitalization, the deaths, or just the fact that they've contracted it? Because we've had children have contracted colds in the past, and we didn't keep tabs on that. So I'm a little confused why there's such an emphasis on this, even though it impacts children much less than something like influenza has, and we never implemented any of these policies. Okay, thank you. Also, are you guys taking any steps to kind of regain the control that you've lost from the state, now that the state has superseded your health and safety protocol? Are you guys taking any steps to try to pull back the reins into the district's hands?
Are you saying, are we trying to fight the state and what comes down from?
Not fight, rather, use the district's judgment, because the state can put something out there that may apply in Philadelphia, but not necessarily in Lake Ariel, Pennsylvania. Two vastly different demographics.
We do work with our local representatives. We work with our educational organizations to advocate for districts on our behalf, to go and quite honestly lobby at the state level for various issues, not just pertaining to COVID.
Okay, and I guess this would be another question. Like you mentioned earlier that maybe I misheard you. Are there shorter quarantine periods for vaccinated close contacts? Is that correct?
If the person is not tested positive, there is no quarantine for a vaccinated person unless they're symptomatic.
Okay, but the vaccinated person can still spread COVID, is that correct?
Potentially, if they're positive again. So the requirement is if they're symptomatic to get tested, the recommendation is to get tested, and if they have any symptoms, then they would stay home. We would have those individuals stay home until they're either asymptomatic or they tested negative.
But there are two different standards for vaccinated and unvaccinated individuals, though they can both spread and contract COVID, correct?
I'm not certain what that question was. That was a bit confusing. I'm sorry.
So you're holding the close contacts to two different standards, right? Whether they're vaccinated or unvaccinated.
Yes,
there's a difference.
We follow the guidance of Department of Health and CDC.
Okay, so you're following the guidance, not necessarily the fact that they can spread COVID, whether they're vaccinated and whether they're unvaccinated.
Again, I'm not a medical professional.
No, but that's a fact. That's not, you don't have to be a medical professional. That's just a fact.
Okay.
No, all right. So, and also you mentioned that we can't, as parents, decide that my son woke up with a bloody nose or a headache, and that wasn't from the masks. However, you guys are solidly determining and making decisions based off the fact that you believe that the center of spread is in a cafeteria or a gym or sports setting. How can the district identify that that COVID came from a specific source, but a parent is not able to determine that their child is having a negative, that masking is having a negative physical or mental effect on their child.
Can I make that determination? I'm not a medical doctor or a psychiatrist.
Well, you're making the determination in your previous comments.
No, I said there's a potential correlation. I didn't make that determination, so.
Thank you for clarifying, because you did earlier, you did state that.
There was a correlation. That's different.
No, you did earlier, you didn't say correlation. You said
yes, I did.
It's a spike from those areas. That's what you said. So I thank you for clarifying that.
Yeah, no,
right.
I did say correlation, so thank you. And we do need to go on to our next public comments. Please, if we can move along, thank you.
All right, next on the list, we do have Victoria Palazzo, who is also on the call. So Mr. Seaman will allow her to unmute at this time.
Okay, Victoria, you should be able to unmute.
I am here. Can you hear me?
Yes, we can.
Okay, thank you. Good evening, guys. Thank you for letting me have the opportunity to speak here. I just want to verify my understanding real quick first, before I get into my topics. From the conversation earlier, I just want to verify, and I know that it's been a very heated topic. If you are a vaccinated individual and you are exposed, you are not required to quarantine if you have no symptoms, if you're not tested, or if you got a negative test. Is that correct?
Yes, the current guidance that we're working under is that vaccinated individuals do not have to quarantine if they're exposed. However, unless they are symptomatic, correct, or they test positive, then they would have to quarantine.
Okay, the concern that I have with that alone is that the only difference between an unvaccinated child and a vaccinated child is the symptoms. The whole point of the vaccine was not to necessarily stop you from getting it, but to lessen your symptoms. So you do have a potentially positive child if they chose not to get tested, because I'm vaccinated and I'm okay, you know what I mean? So if that child is in the school with a positive case but has no symptoms, they are spreading the virus. They have the same propensity to spread the virus as a child that's not vaccinated. Is that not a concern for you guys?
Well, yes, it is obviously a concern if that's the case, but again, it's very difficult to make that determination. So, and again, I believe and I can't speak for the CDC or Department of Health, but I believe that the whole point of that is to be able to keep kids in school as much as possible, and to, while it may be a potential risk, which I'm not sure what that may be, but it is greatly minimized, and by it being vaccinated, you mitigate the potential for that.
Okay, I think we'll agree to disagree on the science behind that one. My topic of concern tonight when I came into this was the bathrooms in the high school. I know currently there is a very immature and stupid TikTok challenge going around where children are being encouraged to vandalize or steal from the school. And I do understand that there's also, from what my children have told me, a problem with students vaping in the bathroom or doing things that they're otherwise not allowed to do. But from my concern as a parent of a child who doesn't do these things, when I'm told that there's only one bathroom for the boys in the entire high school to date that they've found that's unlocked, That to me poses a problem, and I'm wanting to know what the school district is going to do to mitigate the risk, to not punish those who are doing the right thing, but to try to crack down. And I understand that you can't put cameras in a bathroom, you can't follow people in or pat them down, but there has to be some sort of a way that the children that are not actually misbehaving and who are there to do the right thing will have the freedoms to use whichever bathroom is closest to their classroom, so they're not missing class education. What are we doing about that right now?
Yeah, and that is a valid concern, and one that we have been struggling with, not just this year, but for several years as vapes have become more prevalent. So the purpose of secluding some access to bathrooms is to be able to have greater supervision of those areas. So, you know, with limited staff to be there outside to monitor students going in and out, you know, checking in after students go in to see if there was any damage at a given point, or if there are any aromas that were there. A lot of times we have to rely on student reports to become aware of something that took place, as you said, because we can't have the cameras in the bathrooms. And, you know, privacy issues are a big concern as well. So we're trying to increase the amount of staff that are there, the frequency that the staff is going in and out of those facilities, as well as trying to communicate to kids, you know, the dangers of vapes, et cetera, the consequences of a TikTok challenge as they were doing, which is very disheartening, quite honestly. And you know, vandalism is one thing that is, you know, we believe is just, it's unacceptable. And, you know, we do try to hold those students accountable to but again, you know, we're fighting several fronts in that fight.
Okay, so how long do you guys expect, and I know that this is a very difficult question, but how long do you guys expect to have the bathrooms locked down for the students that aren't having an issue with behavior and who, I mean, basically have a good head on their shoulders? Or is there going to start being a problem where these students are going to be penalized because now they have to go from one end of the building clear to the other end to use the bathroom and then come back?
We're hoping that, you know, some of these steps we're taking to minimize these occurrences will allow us to open up other areas as they become less frequent. We did have other areas open at points throughout the last several years, but as things became apparent that we're having a lot of issues and concerns, we had to take certain steps, unfortunately, to the detriment of other students, which I agree is unfortunate. It's not an ideal situation, but you know, we have a handful of students causing a major disruption for the majority.
Is there a plan going forward with how to deal with that, or are you guys still working on that? I'm
Yeah, I mean, we're in constant discussion with our school police officers, with other school districts. I know this is not just an issue with us. As you said, TikTok is you know, it goes viral and it's everywhere. But we're talking with amongst ourselves, amongst other districts, and you know, we'll continue to do so to see what other measures we might be able to put in place.
Okay.
So again, you know, right now there's not a great answer, but we're trying to do as much as we can with the staff and facilities that we have to hopefully minimize it.
Okay. That was the only other question that I had was just that. Thank you.
Thank you.
Rose, is that it on public comment?
That is it on public comment now. Thank you.
Okay, Mr. Gershi, would you like to go ahead and do our orders for us, please?
Okay. I move that we do, that we approve a consent block of numbers 5 through 25, withholding numbers 12 and 13.
I'll second that, Bill.
Okay.
Okay, so that motion was made by Mr. Gershi and then seconded by myself. Are there any questions or comments on those? Hearing none, all those in favor say aye. Aye.
Aye.
Any opposed, say no. Any abstaining? Okay, those pass. I would like to make a motion for number 13, with the exceptions of the covering requirement as listed, but I would like to add that a doctor's note would not be required.
Also, you were going to do something about 12, Bernice?
No, we don't have to make a motion on that. If
We're just dropping it?
yep, in order for it to be voted on, it has to be a motion made,
In other words, you're withdrawing 12.
right? And then we're just doing 13.
Okay.
Okay, so that motion was made. Is there a second?
I'll second.
Okay, so that motion was made and seconded by myself and then Mr. Auckland. Mr. Gogolski, you still want individual time? Does anybody else want to speak, or do we just want to vote on it and then let everybody speak? How do you want that done, Jeff?
I think with the amended, I'm okay. I don't need to speak. I can just vote.
Okay. Okay, all those in favor say aye.
Hey, hold on, Bernice, can you just read 13 then one more time, the way that you amended it for me, please?
Yes,
That's all.
it's, Joe, it's going to be as listed, but a doctor's note would not be required.
Okay.
Are you okay with that?
Yep.
Okay. So all those in favor say aye. Aye.
Aye.
Aye.
Any opposed, say no.
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 Okay, that motion does not carry. Any other information that anybody would like to speak? The information is there for this evening. Dr. Barrett did go over that. Anything else? We will have an executive after this, but the meeting is adjourned.
Move to adjourn, Madam President.
Thank you.
Thank you, everyone. Have a good evening. Board will, I just have one thing to run by you in executive.
Matt, I have a couple of things to say in executive.
Let's just wait till we